Hi, my name is Moises Ceballos, and I'm going to talk about the effect of exercise on cancer-related cognitive impairment and application for physical therapy. In definition, we have that the physical exercise has been shown to be effective in slowing the progression of age-related cognitive decline in older adults with MCCA. However, the most effective type and dose of exercise for improving cognition has yet to be determined. Applications in physical therapy. The role of physical activity and exercise training and its application in the prevention, treatment, and post-treatment of cancer has been widely investigated, highlighting that 75% of the meta-analyses show positive data and having published different clinical practice guidelines for cancer survivors.
There's days that I can't get out of bed because my body just hurts so bad, and you're on so many, not only chemo medication, but you're on different home medications.
I'm Laura Bleck, and I've been a physical therapist in the Valley since 1998. And at that time, my former employer had a bunch of us therapists lymphedema certified.
Originally, I started coming because I had a small case of lymphedema, so I thought that's all that I was going to be working on was my right arm, and that was it. But we've been working on strengthening, getting my, heart rate up for cardio, and it's helping me just try to get my strength and energy back. Instead of having to lay in bed all day long, now I can get out and do something. And I snowblowed the last 2 days, and there's probably no way I would have been able to do that if I didn't have the program.
So when the Fox Valley Hematology and Oncology group decided to come this way, we asked if we could be part of their rehab services to offer truly a full comprehensive care for their patients.
I've gone through different physical therapy before for all sorts of different things like neck injuries, wrist injuries, and she just has that really good personality, kind of like I've been able to kind of open up to her and talk about our families and stuff like that. Just kind of made it feel warm and welcome, like a place that you actually want to come to, instead of like, oh, this is another appointment I got to sit through for like an hour.
Over the years, working with the cancer population has just, it's been such a rewarding experience that we wanted to do something more for the Valley and truly meet all of their needs. There's studies that show, 65 to 85% of cancer patients will have some sort of functional impairment following their cancer treatment. And as cancer gets looked at more as a chronic disease, it's definitely important that we get these patients in so they can return to their normal jobs, or if they're mothers that have young children at home, that they can be as active with those kids as possible. And so we definitely can help more than just the patient who has that chronic swelling. We can help patients just get back to their normal quality of life.
Pros and cons. In pros, we have that there is a lower risk of developing proximal and distant colon cancer, improved lifestyle, lower risk of obesity and sedentary lifestyle. In cons, predisposing factors such as age, gender can vary according to each patient.
My name is Professor Robert Thomas. I'm a consultant oncologist at Addenbrooke's and Bedford Hospitals. Physical activity helps patients in a number of really good ways. It reduces the side effects of treatment, it makes patients feel better, and more recently it's been shown that regular exercise after cancer will actually reduce your risk of relapse and improve your overall chance of living a healthy, long life. Traditionally, doctors and nurses have often advised patients to rest during chemotherapy and radiotherapy or after cancer treatments. In this case, however, rest is not best. A common side effect of cancer treatment, such as chemotherapy, is fatigue, which leads to reduction in mood, maybe anxiety, and ultimately depression. Regular exercise during these treatments has significantly been shown to improve psychological well-being, improve mood, and prevents what is sometimes called chemo brain. So during initial treatments such as chemotherapy or radiotherapy, the trick is to avoid inactivity, to keep moving. After these treatments are finished, the trick is then to try to exercise a bit more vigorously. Aim for about 2.5 to 3 hours a week in an activity you enjoy, such as brisk walking. After many cancer treatments, patients are a bit knocked down, so you can't suddenly just go to the gym and exercise vigorously. So it's important to build up slowly and perhaps incorporate more physical activity in just your daily life. Take the stairs rather than the lift, maybe get off a bus one stop earlier and walk the rest of the way. And just generally, try to go for walks throughout the day. And then after that, perhaps try to join a dance class or a gym, something you enjoy for the long term. Relatives often say, what can I do to help? Well, one thing to do is accept their help. Go out and join a gym together, join a dance class together, maybe even buy a pair of training shoes together and walk in the park. There are specific exercises to do depending where the original cancer was or what surgery was undertaken. For example, if you have breast surgery, it's recommended to exercise the shoulder and upper chest. And those instruction sheets should have been given to the individual after the initial treatment, and if they haven't been given, they can ask for them. Exercise is safe, and there's a lot of evidence that it will benefit individuals after cancer. So there's really no excuse. You have to go out now. There's nothing stopping you, there's no barriers, and you'll feel the benefit immediately.
For information.
ISU at Lead in Ecuador. Ecuador has several preventive physical activity programs for cancer patients and older adults at risk of active break. In conclusion, the physical activity contributes to stop cognitive impairment in elderly. It provides physical, emotional, social, and behavioral changes which are related with the well-being of the patient and also with a better life quality. Thank you so much for your attention.